This video looks at the effects of strobe eyewear on shoulder elevation, active range of motion. Trial 1 is with no eyewear. SENAPTEC strobe eyewear at level 7 is introduced for Trial 2. These videos were taken with the patient who underwent left-sided total shoulder arthroplasty, aka replacement. She performs 5 repetitions for each trial. There is an immediate improvement with her left shoulder elevation, active range of motion while using the strobe eyewear. You can see an increase in thoracic extension in Trial 2. However, the increased thoracic extension would not have a significant effect on her shoulder elevation range of motion. Trial 3 is a retest of Trial 1. The change with improved shoulder range of motion is maintained, if not improved, from Trial 2. The time from one trial to the next was 10 to 15 seconds. Look at that improved range of motion for her left shoulder. Now, some of you may be wondering, did her improved shoulder range of motion come from a shoulder shrug due to increased upper trapezius activation? Well, we can see from the posterior view that is not the case. There was also not a change with her lateral trunk flexion. While her strength and stability for the left shoulder still need work, the change is undeniable. Turn up the audio and listen to her comments.
Whew. That's crazy. That is crazy. Like, that's crazy. Wow. Wow. I can't even fake that.
To maximize recovery, you have to go beyond your regular treatment approach.